Good afternoon. Welcome to the daily briefing. Sorry we're a little late. The chairman was on an important call, but we'll get right into it. Here with Brian Whitaker, the Assistant Director today of EMA, and he's going to be doing the numbers for the health department. It's been a crazy day.
Thank you. Tested in St. Clair County, we have 115,645. That's an increase of 1,140 since yesterday. Positive test, we have 9,246, which is an increase of 94 since yesterday. Those are males and females from under the age of 1 to above 100. Our daily county positivity is 8.2%. Our negative test is 106,399, and we are happy today to report no new deaths, which leaves that number at 222. For those that have completed their IDPH 10-day required isolation period, we are at 8,319. For state totals, they have tested 7,637,209. That is positive tests of 402,401, which is an increase since yesterday of 6,943. For deaths statewide, unfortunately, they are announcing 36 new deaths, bringing that total to 9,711. For hospitalization numbers in St. Clair County, we have 44 COVID-19 related patients, and 7 of them are on ventilators. And for the region, there is 95 COVID-19 related patients, and 13 of them are on ventilators. For our congregate care facilities in St. Clair County, we will announce the ones that have changes. Brightly Senior Living has 20 cases and 0 deaths, which is an increase of 7 cases. Caseyville Nursing and Rehab has 35 cases and 2 deaths, which is an increase of 1 case. And the Esquilin Dammert Center at the Shrine has 59 cases and 8 deaths, which is an increase of 2 cases. One thing we always want to encourage everyone to do is make sure you're getting your flu shot. As the flu season is coming up, that's one thing very important that can be done to help prevent that illness and help not compound anything as it relates to COVID-19. Additionally, we want to remind everybody that IDPH is doing a drive-through clinic at Belleville East High School this Sunday from 8 a.m. to 4 p.m. Chairman?
Great, Brian, and we encourage people to go get tested.
Absolutely.
So we'll move into the zip code report. These are the changes of COVID-19 status in these particular zip codes. 62201 up 2 to 292. 62203 up 8 to 288. 62205 up 3 to 249. 62206 up 5 to 543. 62207 up 2 to 281. 62208 up 4 to 542. 62220 up 3 today to 695. 62221 up 10 to 850. 62223 up 7 to 575. 62226 up 10 to 979. 62232 up 1 to 251. 62254 up 1 to 301. 62258 up 4 to 251. 62260 up 1 to 176. 62264 up 2 to 116. 62269 up 6 to 741, and 62285 up 3 to 156. As Brian said, we had an increase of 94 positives in St. Clair County today out of 1,140 tests, which takes our daily county positivity to 8.2%. That brings our 7-day rolling average to 8%, a number that we do not want to be at. So we've got to continue to drive these numbers down. Wear your masks. That's the key. The state pegs our regional positivity today at 8.7%, and that's derived by the fact that Bond County comes in at 13.2%. Clinton County comes in at 7.6% today. and they tested a number of people there, so it was a 7.6% came out of that. Madison County's at 14.3% today. Monroe County rolls in at 20%. Randolph County, 15.5%. St. Clair County, 7.7%. And Washington County is at 15.9%. So all of those numbers that go above 8 lead us to be at an 8.7% regional positivity.
Which is up from 8.5, which is, we said, it's going in the wrong direction. And, and you can see from the numbers from the other counties, when they test, those numbers come down. They fluctuate. So the more testing we can get done, the better off.
Well, it allows you to isolate the virus. You're finding people that don't know they have it. If people know they have COVID, they're not going to go out and spread it. They're not going to go out to see friends or go to gatherings, Halloween gatherings or family gatherings, that are really, this is the season for those. We encourage people to get tested. If you're going to be doing something like that, get tested, find out. Let's isolate this virus. Don't spread it to people you love, to people you know. Let's get rid of COVID. And the only way to do that is to isolate it and have it end with you. That's the key. If you have it, don't give it away. Keep it. Get rid of it yourself.
Well, and we had the two of the local physicians in here this week talking with us, and they was really stressing the fact about, like Brian brought up, get your flu shots, because the worst thing we want is a double pandemic here. And they were really, really emphasizing that, because it creates more problems within the hospital, diagnosing it, making sure what they're treating you for, along with making sure they got the amount of staff that they need. So
it's not really a double pandemic, but it's a current pandemic situation. And then the flu always puts a lot of people in the hospital. So it's trying to keep those beds free for those that really are going to need it. And many times when you catch COVID-19, you need a hospital bed.
Right. The number we've been watching a lot along with the hospitalization is the age group. The age breakdown under 40 today, 44 of those people under that age limit. So we're seeing it, and it's just not in the elderly like it was when this thing first started. It's some of them cases today out of the 94, as Brian said, under 1 year of age up to 100. So a wide spectrum of the age there that it's affecting. So, and as we say all the time, you got to take care of yourself to take care of everybody else. And that's what we're saying here each and every day. Watch your social distancing, wear your mask, wash your hands. Good personal hygiene goes a long way, is what the doctors have all told us. So if we continue to do them, hopefully we can get them numbers down. Right now they're not going in the right direction. They've got to go down. We got to worry about our businesses. We get calls every day, and we know it's not a good situation for them. A lot of them's calling and saying we're trying to do the best we can, but the way we can all help them is by supporting them the best we can. And the biggest way is everybody chip in, get these numbers down, and we go back into below that 6.5, and then get back to some sense of normal. So we'll be back with Cindy and Daisy in just a few moments to translate this into the Spanish communities, and then we'll be back tomorrow afternoon with the next set of numbers. Have a good evening.
Mask, gloves, soap, scrubs, TikTok, Grubhub, Twinks, Jocks, Bears, Cubs. Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
No school, gym closed. Don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish. Don't come close. Just wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time time it is. Come on, stay inside and lock the door. Stay inside and lock